Thanks very much. My name is Terry Hayes. I'm an Assistant Director of Nursing in the Waterford Mental Health Services. And this is my colleague Joan Croke-Power, who's the CPC. I suppose our role in Nursing Metrics goes back over the last 3 years. And I think there's 2 points that come out for me here. And I think that the culture of the organisation that we work in our service, we have metrics across 7 areas on a monthly basis. And I think 2 of the challenges we faced really were from within the MDT, multidisciplinary team, where people saw this as a nursing-led initiative, which it is, and that was the message we tried to get across to people, that this is nursing and we're going to drive it on. Today, I'm glad to say that the MDT are on board and we have greater and closer cooperation working with other professional teams. And the second one, I suppose, it's nursing. Sadly, it reflects on nurses where it's the culture blame where they see it in medication management that the doctor wrote the script wrong. He didn't put the generic name, he didn't do it in capitals, he didn't sign the dosage. And the way we come across that is that the bottom line is at the end of the day, you're the nurse administering the medication. So it is up to you to call that doctor back and say, this needs to be written in capital letters. And it's on the front of the medication, the MPAR or the Cardex as we call them. So I think it's been a good experience for us over the last 3 years, and we're looking forward to the next stage. Obviously, we have it in 7 settings, and we'll move it on further over the next while as well. So I think we could identify with all the speakers this morning, because you really have to come with a passion when you're doing it, and because that's what sells it, I think, at the ground level as well. So thanks very much.
Hi, I'm Morla. I'm a CPC in CUH. I have 2 questions, actually. The first one, Breda, is just wondering, just from an operations perspective, and as Mary Ellen described, you said, at-risk behaviour, and I would see the medication prescribing incorrectly as an at-risk behaviour. And I was wondering, do you get that documented in an incident report form? Yes. So any incorrect medications prescribed incorrectly are reported on an incident form?
Yes, and we, as I said, we have quarterly reports.
Great.
Interestingly enough, as I mentioned in my presentation, we have nurse and midwife prescribers in our hospital, as I'm sure a lot of you do. Yeah. And when I was doing my auditing, the nurse prescribers actually were on point. There was no problems. It was actually to do with the NCHD. Yeah. Now, I didn't want to pick them out as a category of people, but I did mention it at one of our governance meetings. It went down like a lead balloon, I can tell you, among the doctors. Yeah. But we have to be realistic here. Good practice is really important to safeguard the nurses that are out there and midwives that are giving these medications. So as we've all said, that's why I've probably focused a bit much on the medication management and prescription aspect, because it's the biggest thing that has come out of it for us in the maternity services, and it's such a big deal. So
okay. That's very good. Thanks. Yeah. And the other question I had was just for Nora, and I suppose that the day really, and it ran through every presentation really, is that metrics has to come from the bottom up, I think. And just, Nora, in relation to the governance structure, who attends those 8 weekly meetings? Who do you have there at the table?
Usually the lead, all of the collectors that can attend. There's a group email that goes out to all the collectors and the director of nursing, and then we just meet then and go through how the last month or two, and plans for the following month or two. And again, it's because I think our locations are so wide. 65 locations around Cork City and County, it's a lot. And what we found at the start with these meetings were really helpful in relation to being 100% sure that we were all seeing the same thing, that we were...
It's very important that
yeah.
the governance structure is correct, that we're all, and that comes from the top. I suppose it's just interesting, that the DON sits in it and it sits there, and I think the culture starts there and down and residents down.
Absolutely, yeah. Now, she may not make all meetings,
but a representative.
Absolutely.
If I can just add a comment there, I suppose just to say, this morning has really shown, I suppose, that over the last couple of years we have managed to embed measurement and nursing. And I suppose I do have to say, I do think we have a bit of a journey to go yet to educate all ourselves further on data interpretation. We have to date on our reporting been using a red, amber, green RAG rating system, But I just wanted to let you know that we are working with the Quality Improvement Division and the HSE, and I suppose going forward for us, we will be ensuring that the data is also presented in what's called SPC charts, Statistical Process Control Charts. And I do think it's really important that we build our own knowledge and capacity in that area so that we're not being punitive to ourselves and our teams as well when we're looking at data, because sometimes there are trends, and it could be, you know, specific things that are normal variations or things outside of the norm that we need to be conscious of. So just to let you know that that work will be happening in the oncoming months, and we'll be getting that out to you.
Jonathan Drennan, Professor of Nursing and Health Systems Research here at UCC. Congratulations to the panel, the fantastic presentations. One of the gratifying things was, and this being my day job, I'm going to say this, that the drawing upon the research evidence was great to see, and the developing the metrics. But I'd like to ask the panel now, going forward, what are the research priorities you see in relation to the work that you're doing for the future? An easy question.
How did I know you were going to ask that, Jonathan? Well, we've been doing some really deep thinking and planning, and a lot of reflecting on how you in the services have got to where you've got with the metrics, and where we're going to go to from here. We will have one chance to get this right, so we're spending a lot of time on planning so that we know when we start moving out with the new metrics and the ones that have been co-designed, that they will be supported. Now, this is a journey, and it's a really exciting journey. I think it's one that will empower nurses and midwives greatly. That is our fervent hope for it. And we've been exploring, and we do feel that we will have a research stream running beside it. What type of research, what methodology, how do we describe the journey, how do we learn from it, how do we share our journey? Because this is probably, we're a small country, so we have great opportunity to do this nationally. So we have been thinking about it, Jonathan, and we're still thinking. Yeah, so, you know, it could be research in action, action research, it could be, you know, we could use a triangulation method where we use a number of methodologies to get at the truth of it. But it hasn't been crystallized yet. So, yeah, it's in process.
If I could just add as well, I suppose, yes, as Mary says, we're having many discussions with many people around further research and evaluation. But we really would welcome some guidance as well from the bottom up in relation to your own thoughts, because as Mary says, we have one opportunity to do this and to get it right. But I think the opportunity that's within it as well is to get our work out to an international audience, because I think we're so humble in Ireland. Sometimes we don't really appreciate what it is that we've got here. And particularly from listening to your own presentation, Mary Ellen, there's some great work going on in the States, but there's some blooming great work going on here as well, you know. So yes, so from the bottom up, and also from the academics feeding in from the side to us as well, we would really welcome your own thoughts around how we move evaluation forward.
This is a question for Breda. My name is Mary Stack-Courtney from the Maternity Services in Kerry. Just to say, I enjoyed all the presentations. Breda, in your development of the midwifery metrics, have you any plans to move this forward and communications with the NMCMS development group with regards building it into the e-record that will be introduced to all the maternity hospitals in this country?
I'm not quite sure how that's going to evolve because, to be honest, we haven't got online with the electronic chart just yet. So I'm not really up to speed with that. So maybe one of the other speakers might be able to answer that. I do know marrying the metrics as they are with the electronic chart will hopefully make the data collecting easier and will focus on what's important. So that's my aspiration. And just one thing I wanted to mention, because Mary Ellen mentioned the Toyota production system. I think standard work processes are really key to metrics collection. And if we all work and sing from the same hymn sheet in regard to collecting our data and taking care of our patients, we'll do a very good job. Maybe is Rosaline going to answer about the question about the chart? Thanks, Rosaline. Rescue me here.
Not in any way better, Breda, but that work is done with Professor Declan Devan. I have to compliment my colleague Katie Burke, who's not able to be here today. Herself and Declan have actually matched the new metrics, the new suite that will be rolled out for the maternity services, and they'll be more easily collected off the EMN-CMS. They match the EMN-CMS, which is fantastic for us going forward, because we've just rolled out the metrics in the COMH, and that's one of the issues we're having at the moment, is that they don't actually match it. So we're delighted to have them coming forward now in the next couple of months that they will. Thanks.
And I would just add, one of the things that's helpful, and I'll let the academics speak to this, if that students can be taught, if you create standard work, the students are taught using those same instructions and metrics. We even teach math to everyone the same way using dimensional analysis, because then we can see where the student, if they're not figuring something out correctly, why, where are they? We can get where the problem is. So I think we can do it on the academic side as well, and then they'll even be ready to launch and move into practice much more easily, really understanding safety and quality.
Just, I suppose, in relation to the midwifery metrics and the new information system in midwifery, just to add, I suppose there are a few practice development coordinators around the country that, particularly the sites that have the new midwifery system in place, that are currently looking at the new metrics with a view to developing the standard operating procedure aligned to that system. So that work is currently underway at the minute as well. Because I think we all agree we're all busy people, so the burden of measurement, if we can make it any easier for people.
I'd just like to say on a broader note that I have been asked to chair the National Clinical Records and Documentation Group for the requirements specification for a national EHR. Now that's a bit of a mouthful, but basically it's the electronic patient record. And come hell or high water, I think one of the requirements will be that it will align and there will be capability to collect metrics through that system and report on them easily.
Hi, Marie Last, Practice Development Coordinator in South Tip General in Clonmel. In our hospital, we have 3 metrics running at the same time. We have acute care metrics, children's metrics, and midwifery metrics. And I'm just wondering, is there any plan going forward now to look at a breakdown of speciality metrics? For example, in our acute care metrics in our midwifery metrics, we're currently measuring our special care baby unit metrics using the children's metrics, but they don't quite fit. But there is a requirement from local governance that it is measured, but we have a lot of non-applicable coming within that because newborn babies don't meet some of the metrics that come under children's. And then certain things under the acute care metrics like intensive care units and in the emergency department. And I'm just wondering, is there a plan to develop them in the future?
Well, there's no immediate plan, Marie, to disappoint you straight away, but I suppose I do agree. I suppose, look, we're on a journey. We have started a journey in relation to measurement, and I think one of the speakers did say already this morning that, in 12 or 18 months, we may end up with different measures as well. This is a journey that's not going to stop now that we have a few robust suites. They will continue to evolve. one of the things I think that I feel that worked well for us was the establishment of 7 work streams where we had staff of all grades, of all disciplines from everywhere in the region coming forward, sharing their voice in relation to what they want developed. I think it would be good to keep that sort of structure together some way or other. And I think in particular the new metrics that need to be developed, we have a methodology to develop metrics that we've tested. I think there's no reason why that couldn't continue for future metrics to be developed. So that would be my thoughts.
Oh yeah, we don't expect it straight away, but it's just something, you know, to plan for the future. And I'm sure in some of the bigger hospitals, they probably even have other requirements where they have other specialities such as neurology and everything as well. Thank you.